The hip joint is quite a complex joint. It's essentially a ball and socket joint. The ball part of the joint is from the pelvis, and the pelvis is made up of three different bones: the sacrum, the ilium, and the pubis bone. The ball part of the joint is the femur bone of the leg, which is essentially the thigh bone. It's got a shaft, a neck, and a ball, and together the ball and the socket articulate. The hip joint has got some very strong ligaments in the pelvis, which are the strongest ligaments in the body, and the whole thing is reinforced by muscles and ligaments. There's also something called a labrum, which goes all the way around the socket, which deepens the socket and gives it some more stability. Mostly in the hip, winter sports injuries are either fractures, that can be either to the pelvis or to the femoral neck or to the femoral shaft, or sprains and strains around the hip joint. Now, there's not very much work being done in terms of looking at specific chronic type injuries to the hip, but there are a few suggestions that some skiers have a history of labral tears, and that's the labrum that deepens the hip socket joint, and some people may be more susceptible to them. Fracture while skiing, it's relatively common. It's usually due to a very high impact activity, particularly in skiers. So those people who have gone far too fast or got out of control on the slopes and gone into either another skier or a tree, and they're usually emergencies. They normally get taken off the slopes by ambulance and get taken straight off to hopefully get it fixed. In terms of other fractures caused by other problems, I mean, whilst it's a very common problem in the elderly, it's not so common in the younger people, and it has to be a real big trauma for a fracture to occur. In general, if people are safe, it's not usually too much of a problem. I don't think damaging a hip is something to worry about whilst on the slopes. I think if you do get a hip fracture, you've probably got a lot of other fractures as well. Although you do get the older generation now skiing, so in the 50, 60, 70-year-olds, people can still have the same insufficiency fractures as anybody else, even by a minor fall. And it's also possible to fracture the pelvis. All these injuries may, although they're fixed in the first instance, may lead to arthritis in the hip, requiring further intervention. Nobody really knows whether there's a greater risk to injury either by skiing or by snowboarding. What we do know is that snowboarding has a higher affinity of injuries to the upper limb. So based on that, one would assume that skiing would be a more common way to injure one's hip. Whether a soft tissue injury to the hip or a fracture is more common, again, nobody really knows. It makes sense because of the force involved in breaking the hip, and that those type of injuries are probably more common than just a sprain to the hip while skiing. There are other ways to injure your hip, but in terms of just skiing and snowboarding, I think a fracture is probably the most common. Okay, so the advice I would give if you're taking part in winter sports is to be careful. Don't go off the normal slopes. Try and ski within your means. If you're a beginner skier, don't go down the black run straight away. There are certain ways one can fall when you're skiing. If you go to a lot of the ski resorts, a lot of the instructors will tell you the sensible way to fall if you do get out of control, to try and protect yourself from serious injury. And the other thing is to watch out for other people. The slopes are extremely busy at this time of year. There are skiers all over the place, and you just have to keep your eyes open and eyes peeled to other dangers. So there may be a tree in the way that you're not really concentrating on. There may be other people going in front of you, so you just have to be aware. The symptoms that might be overlooked as a serious hip injury, some people are extremely pain resistant, and some people will have a big fall and they may injure another part of their body. And it may not be until a few hours later they realise their hip really is very, very painful and they can't put very much weight through it. That could lead to a missed fracture. There could be a stress fracture that somebody's missed, and these things are certainly worth looking at. So any ongoing groin pain following a ski injury should be seen and should be investigated further. If somebody suffers an injury during winter sport, my advice is to depending on the severity of the injury. If it's a severe injury, the advice would be to go off the slopes by ambulance and be treated by the nearest hospital. But if they've got ongoing problems following return from holiday, it would be certainly to get some further advice. And if it's a hip that's painful, go and see a hip specialist. They'd be more than happy to see you and get some x-rays, get some further investigations to try and diagnose what's going on.